Welcome, my friends, to my home studio. My name is Robin Black. I'm a martial artist, and I was the creative consultant on season 1 of Dark Side of the Cage. Today, I'm going to share with you the interview with Dr. Faisal Rehman in its entirety. In this conversation, we chatted about Ronda Rousey. We chatted about concussions as they're related to Ronda and fighting in general. And we talked in detail about Matt Hughes' injury from when his car was struck by a train. Dr. Faisal is a fascinating guy with a wonderful perspective on combat sports from the mind of a very high-level cage-side physician and professor. And let's get right into it. This is Cage Talk. Matt Hughes with a little bit of Ronda Rousey. This is Dr. Faisal Rehman. My friend, Dr. Faisal Rehman, welcome back. We talked about Ronda Rousey, and people loved it. It was a fascinating conversation. Thank you for that. I'd like to ask for your insight today about Matt Hughes. Are you familiar with Matt Hughes' injury that he sustained when his car collided with a train?
So first of all, Robin, thank you again for having me on. I love speaking to you, and it's a big honor for me. Absolutely. The Matt Hughes injury, horrible. I just don't know what else to say. Being hit by a train while in his car. And although I'm not well versed with the exact mechanism as to how that happened, I know there's actually some lawsuits ongoing right now with respect to that. It's the worst form of head injury, being hit head on by in a motor vehicle accident, and your head hits the window or hits the side of the car. Your brain is shaken, and you get severe brain injuries. And sometimes you're lucky, and it's just a mild concussion. Other times you get a big intracranial bleed, and you're in the ICU intubated. And other times you're left with diffuse axonal injury, and you're no longer the person that you were previously. So devastating. And when that happened to Matt Hughes, I was very saddened. He's an amazing athlete, a pleasure to watch in the UFC and to watch him compete and excel as a welterweight champion, but devastating.
You talked about the more extreme injury, and I think that is what Matt has been diagnosed with. Can you say what that is again? And then, as a medical doctor, can you explain a little? And you are, of course, a ringside physician. You are a martial artist. You've assessed and cleared and tested many dozens, maybe hundreds of martial artists. Can you tell us what this injury is that Matt sustained, and tell us about it?
No, it's a great question, Robin. I've not looked at his brain imaging to look at the MRIs and the CAT scans. So what I can tell you is based on my observation of him. And I've been fortunate enough to watch him both on television and at different sports events to see how he is moving and his personality and such. And also, unfortunately, in the media, you hear news about conflict and in his family and conflict with others. And so you can only glean some ideas of what may have happened. I can tell you that he had, based on how he is now compared to the person he was before the accident, he had a severe injury. And if there was bleeding in the brain, what happens is you get swelling associated with that bleeding, and the brain gets squished, and you damage other parts of the brain more because of that. And sometimes after such accidents, you need to drill burr holes in the skull to release the pressure in the brain, so that will hopefully help with healing. On top of that, what is most difficult for the patients and their families is the personality change. So you'll sometimes notice that people can't regulate their emotions. And I got the sense from observing Matt that there may have been a little bit of that. Inappropriate laughter, inappropriate crying, inappropriate, like um, at a time where you should be happy, you're sad, and when you're sad, you're happy. That usually indicates damage to the frontal lobe, which is the part of the brain. And I wonder if he sustained damage to that part of his brain, just given some of the emotional dysregulation I'm seeing, but also what you're appreciating on the news with conflicts that, and unfortunately his marriage, I think, was in turmoil because of allegedly, I want to say, violence in the home or aggressive behavior in the home. So I'm concerned because Matt was a calm, collected guy, and I worry that perhaps his injury affected the frontal lobes, which took away that emotional regulation. And then he also walks with a limp and has a weakness in his extremities, indicating that the part of the brain that controls the movement of his extremities was also affected, and both in the upper and lower extremities, as I recall. So again, that tells me, I wonder, he had such a severe brain injury and there was such severe brain swelling that many parts of the brain were damaged. And also, if there was a lot of shearing, he may have had something called diffuse axonal injury, where the nerves in the brain basically get sheared. And this is, again, without me having been able to look at the imaging, but based on what I have observed, I'm concerned that that may have happened.
And in situations like that, if that were to happen to you or I or a family member or someone we know, what would the prognosis be for healing and improvement in these areas? And what could you hope for as somebody who has potentially sustained injuries like this?
And this is the thing, it's very variable, Robin, because I would dare say that the improvements you make in the first month or two are going to be the most dramatic.
Wow.
And then if you're left with disability after that, it's going to be a much more slower recovery. And likely in many of those cases, if the injury is severe, you may not return to your baseline level of function. But with physiotherapy, occupational therapy, and medical care, you would develop strategies to be able to deal with the new disability that you have, whether it be verbal speaking. You'll notice that Matt's speech is affected, right? Mm-hmm. The centers in the brain, in the temporal and parietal lobe that may control his ability to both receive information and voice out that information were likely compromised. But you can then train other parts of the brain to try and compensate for that using speech pathologists and others. That's just an example. But if after the first 2 months after an injury, if you're left with significant disability, you're only looking for small improvements after that. Wow. That's the main thing, and you got to look at how severe the disability is up front, and then see what happens 1 to 2 months later, and then you can try to give the patients educated information on what to expect.
And if somebody we knew, if our friend, our coach, if Matt Hughes was our family member or our neighbor, if they'd broken their leg, or if they had a severe injury of some obvious kind that we could see, we process that as people different than the brain, which is unseen to us. It must be difficult to in your experience with unseen injuries, for families to be able to process that.
Absolutely. I mean, I know an amateur boxer right now who's going through that, and has had a severe concussion. It was actually a workplace injury. They had done boxing earlier, then had a workplace injury where they're injured in the workplace in an unsafe work environment, and had severe post-concussion syndrome. And the school and the board of where they worked is saying, you just had a concussion, you should be back to work in 2 days. And then putting up challenges and roadblocks to them being able to get care, and then mentioning that they're exaggerating their symptoms. The workplace saying you are exaggerating your symptoms, which is just the most horrible thing because it's an unseen injury. You can't see it, you can't appreciate it, and then on top of that, family members and friends will get upset with you because of your personality change, or because you're not doing things you were doing before, or you're not socializing, because they have no clue what the individual is going through. And even I don't really have an appreciation for someone with severe post-concussion syndrome. I can empathize because I know from my patient stories, but you can see why family members would start to get frustrated. What do you mean you're not going to come out? What do you mean you're not going to go to a movie? Why do you stay in your room all day in the dark? And even your own close circle will have a hard time understanding that. So it's an issue that's very, very important. The workplace especially needs to be educated on this, because the athletes are suffering because they're not getting the care they need from their workplace. And then there's financial issues they run into and such. So it's a big problem. And the fact that it's an unseen injury is a big issue, Robin. I'm glad you asked that question.
Yeah, it's doing this series, Dark Side of the Cage, we've told some beautiful stories, but we do peer into some of these things, and often you're left with less understanding, or certainly more questions than you started with when it comes to brain injuries and as they relate to fighting. There's a long way to go for us to more deeply understand these things, whether it's an injury like Matt Hughes or a lifetime of combat like Ronda Rousey. There's just a long way for us to go, isn't there?
100%. And we need to do more studies, and we need to provide more support, which is why, um, I am happy that some promoters like Dana White, I think, are starting to take this more seriously and are providing the athletes with the medical care they need for the most part. I would have to say the vast majority of sanctioning bodies or fight promoters or commissions are not doing that. So, for example, recently an athlete approached me saying they needed access to neuropsychological testing to measure how much, whether they had any cognitive or executive function deficits from the result of fighting before they could be licensed. Well, who's going to pay for that? That's now between $3,000 and $6,000 for one session, only to get a report saying you may not be able to compete or you may be able to compete.
Yeah.
And more importantly, that testing is very helpful because it could be done serially, and you could follow how patients do, how athletes perform, and determine what their risk is developing, let's say, long-term problems. But that testing is not covered by anyone, by insurance companies for the most part, or by commissions, or for our athletes who are putting their lives at risk for the entertainment of others. So we need to do a better job providing the medical support, and that's I think a commitment that the physicians, the athletes, the commissions need to all get together and try and help provide to our athletes.
Thank you so much for helping me with these topics, Dr. Faisal. Before I let you go, you had a fight only a couple of months ago in your 50s, correct? How did it go? What was the experience like?
It was something else. So I competed late last year in 2024 in October, and it was a beautiful experience in that we raised a lot of money for charity. We raised $220,000 to battle homelessness, medical illness, poverty initiatives in the southwestern Ontario region in Canada. And the fight was a 4-round professional boxing fight, and it ended up being a draw. But it was dramatic. I was knocked down in the second round, and then I almost knocked him out in the fourth round, and it was a draw. But again, the benefits of me competing for my mental health like have been amazing. I work in a very stressful environment. My life can be stressful at times, and I'm so grateful to martial arts and combat sports for, in many ways, in saving my life. And keeping my mental health strong, and fixing things that I had with my health, like high blood pressure, high sugars, which I had when I was quite overweight. So I owe my life to martial arts, and I think that's something that's not appreciated by our community. Despite these awful risks, despite these awful head injuries we sometimes see, despite the risk of chronic traumatic encephalopathy, people aren't seeing what I see in my gym, which is getting kids off the street, helping them with their addiction, helping them with their mental health issues, giving them something to look forward to for, giving them that positive reinforcement that they get from working in an environment with other kids. I think combat sports, mixed martial arts, is life-saving in many ways, but we don't see that. Saying that, we do need to deal with the negative aspects of the consequences of taking headshots, etc. So I'm so happy you're bringing light to this issue.
Well, thank you, my friend. Martial arts has given me every good thing in my life as well. And I speak for everyone who knows you in fighting, but everybody loves you and appreciates you. And thank you for hanging with me. And it's the truth.
No, thank you so much. It's a big honor, and I've known you for, gosh, it seems like decades now. But
I think it is.
Everything you've done for our charity, actually, and for the sport.
Thank you to Dr. Faisal Rehman for the brilliant conversation and for enlightening us about these things. And thank you for your love of fighting, Doctor. We love you, man. Everybody in fighting that knows you, and everybody, all your students, you're a very beloved man, and it's easy to see why. We have one more episode of Dark Side of the Cage, and that is War Machine. And that means we have one more episode of the podcast, Deeper into the Cage, and one more episode of Cage Talk. This has been a great privilege. My name is Robin Black. Thank you, and enjoy the hostilities, my friends.
Matt Hughes, just the greatest fighter in the world at that time.
Good old American farm boy. People would fall in love with him instantaneously. And then he became somebody else. He was in his truck and got hit by a train.
Matt was in serious condition.
He was not the same Matt Hughes that I fought.
Depression hit him pretty quickly.
She allegedly took his cell phone because he was communicating with other women. He goes, I'm gonna shoot you.
Dark Side of the Cage, Wednesdays at 10 on Vice.